Okay, so digestive system, we'll just go over these and then we'll go back and go over renal too. So the digestive tract is the organ system primarily responsible for food absorption and elimination of solid waste. So these are going to affect different areas of that. Plus you have some organs that just move food, but for the most part, your stomach has a couple of purposes. One, it turns food, okay? And second, it preps it. Well, some protein can be absorbed in the stomach, but that's pretty much the only nutrient as far as the stomach goes that gets absorbed there. Beyond that, the purpose of it is really to prep it for absorption in the small intestine. So we'll see some meds that work specifically in the stomach, some that work in other areas. So we'll go. Antacids. So the various types of antacids differ in cation content, which we know is your positive ions, right? Neutralizing capacity, so their ability to neutralize the contents in the stomach. The duration, so how long it takes for food to move on through, then side effects, and then cost, of course. So antacids are generally over the counter. Now you can have prescription strength ones too, but you can, for the most part, get them over the counter. Okay, histamine receptor antagonists. We've talked about these classifications before. So there's 3 types of histamine receptors. So one type mediates acid secretion by gastric parietal cells. So the parietal cells in the stomach is what secretes the acid, specifically in the stomach, that helps to break down food to prepare it for absorption later on. Now these says are preferred to other anti-ulcer agents because they're really easy to use and they don't necessarily affect motility of the GI tract as a whole, like the movement of food through there. So examples of these are your cimetidine, famotidine, ranitidine. Those are probably the most common on here. Tagamet, Pepsin, and Zantac. They all work the same way, and that's what they're going to do. Okay, notice the ending in all of these, okay, is similar, so that's another way. We've heard of other antihistamines that work in other ways. One for allergic reactions, some that work in the respiratory system. So, but these specifically are for the stomach. Okay, then we have proton pump inhibitors. We've looked at those too. The final common pathway in gastric acid secretion is the proton pump. So it's an enzyme that exchanges hydrogen ions for potassium ions. And so these are going to help to prevent that acid as well. And they just work in a different way. That's why they're a different classification. So look, it says these should be taken before meals, usually in the morning. So these are, look, they all end in P-R-A-D-O-L-E. Most common here, probably your Prevacid and Prilosec. Okay. So make sure when you're study the H2 antagonists and these together so that you can look at the difference in how they function and the difference in the names of the drugs too. Okay, anti-diarrheal agents. So diarrhea is a manifestation of many illnesses. It's a symptom. Okay, it can be its own disease. I guess some people just have diarrhea, but it's usually just a symptom. So that's usually what you're taking these medicines for. Most commonly used antidiarrheals are anticholinergics. You remember that word from when we talked about peripheral nervous system drugs and how anticholinergics kind of work as a parasympathetic nervous system. Remember that? So they're going to help to cause the peripheral nervous system to kind of decrease motility. Opioid narcotics, we know they can cause constipation. So in other words, they would prevent diarrhea. I don't think that would be a reason that you would necessarily take those. But Piperidine, loperamide is a specific one. Piperidine is another pain med, but loperamide is a specific one for diarrhea. Okay, laxatives and stool softeners are going to have the opposite effect of those that we just talked about. So constipation, it says, is difficult or infrequent passage of stool. You know that. Constipation is a symptom, usually, rather than a disease. Laxatives either accelerate fecal passage or decrease its consistency. Look at that. Okay, let's look in here. Now we kind of talked about different classifications. Page 40 is the page we're on in.
So are we going through this in order?
No. I'm going in order that they are online, or at least that's how it started out. The order that things are in online, but you don't have a GI section online, so that's why I'm going here. Or I don't think you do anyway. Okay, so page 40, gastrointestinal agents, so antacids again, neutralize stomach acid so that people won't have heartburn or GERD. GERD is really the disease, like a long-term disease that causes heartburn. Look, it says increased frequency of administration may result in poor patient compliance. So some of them, they have to take them all the time, so people aren't always as compliant as they need to be. So some examples, here's milk of magnesia. Probably the most common, and Maalox or Malamantha, you see that too a lot, magnesium hydroxide. So those are some examples of general antacids that you see. Lots of people take milk of magnesia. And that other thing with milk of magnesia is it can also function as a, you'll see it on the, as a laxative too. You'll see it on there too. It's kind of potent laxative anyway. Maalox is usually you see it in liquid form, but you see it in tablet form too. Okay, so here's the histamine, the H2 antagonist, like we just talked about. Block gastric acid and pepsin secretion. They antagonize, they block those. Look, special considerations. Bedtime dose is extremely important in therapy. Drug interactions include aspirin, alcohol, caffeine, cough and cold preparations. Usually you find it over the counter. Usually the over the counter ones, like it says here, are lower dosages than the prescription. So if people get a prescription for it, sometimes it may be, it's just a higher dosage. Let's see, cimetidine, again, ranitidine, famotidine, like we saw up here, Pepsid, Zantac, and Tagamet. Those are all of your H2 antagonists. Proton pump inhibitors, it says inhibits parietal cell, like we just said, the pumps that cause the hydrochloric acid. That's what the HCl is on there for. Indications, gastroesophageal reflux disease, that's the GERD that you always see on the meds list. Erosive esophagitis, and then it's taken with other treatments or with other things in the treatment of H. pylori, which is a gastric ulcer, which is a bacteria that causes gastric ulcers. Look over, they're on the top right-hand side, all the ones that end in prozole, like Protonix, Prilosec, Prevacid, Nexium is like a purple pill. Usually you see Nexium. So all of these.
Coming out with that over the counter?
Do what?
Nexium's coming out over the counter?
I think so. Either it has or it is probably a lower dosage form. But all of these are frequently prescribed. Heartburn and acids are, people buy those over the counter, they are very commonly prescribed medication. Okay, coating agents, says form a protective coat over an ulcer or over to kind of cause the acid in the stomach to not harm basically the inside of the stomach. Your stomach naturally produces mucus, and that mucus, the purpose of that is so that the acid that's secreted into your stomach doesn't also eat into the lining of your stomach. Okay, because it's some really strong acid. And so sometimes either if you have an acid overproduction, it eats through that mucus lining, or that mucus lining isn't doing its job. So some of these can help with that. And if you'll notice, Gaviscon is one that's on there. So that's one example. Anti-inflammatory meds, so for like Crohn's disease or ulcerative colitis, those are two that really affect the intestines and can cause some issues there. So adverse reactions, nausea, vomiting, headache. Sulfasalazine is contraindicated in patients allergic to sulfa, obviously. Got sulfa in it, it's probably got a sulfa drug in it, so if they're allergic to that, they don't need to take it. Patient needs to be kept hydrated, and the drug should be taken after meals. So look, these will stain the urine orange yellow and permanently stain soft contact lenses yellow. That would be something you would want people to know before they start taking it. Antidiarrheals, constipation. Obviously, if it's to prevent or to treat diarrhea, it's going to cause the opposite of that, which is constipation, respiratory depression, or drowsiness. Diarrhea may lead to dehydration of the individual, and so sometimes these can have the opposite effect of what they need to have. Anyway, so examples of antidiarrheals: Pepto-Bismol, Kaopectate, Lamodal. I have seen that Lamodal. I think we've already seen it on the test before. That's one that you'll definitely see on Pass Assured. I know I've seen that one on there before. Loperamide is Imodium. Okay, Imodium, you've seen that over the counter. Pepto is something, I know I wrote this in on there. Pepto has aspirin in it, and you don't give aspirin to kids, so Pepto is not something that you give to children. Drugs for treatment of constipation. So, and these can have, there's different types. Obviously, diarrhea is a side effect because it's trying to make them go to the bathroom. So the opposite of that's a side effect. Docusate sodium that's listed on here says emollients, lubricants, and saline laxatives. Colace, that's usually like a stool softener. That's something people can take every day, just to help with the chronic problem of constipation. It's not as harsh as some of these others. Milk of magnesia and mineral oil, those are pretty harsh medicines for constipation that would seriously cause some diarrhea. Stimulant laxatives. So look, they increase gut activity from mucosal stimulation. So definitely diarrhea, and they can, of course, allergic reactions for anything, and swelling. So these, if they're stimulant laxative, the goal is to make them go pretty soon. Dulcolax and Senecot are two of those examples that you'll see those on here. I've seen those on here before too. Bulk forming laxatives. So these are usually to increase fiber in the diet. Fiber is like a bulking agent, but it also helps go to the bathroom. And there's lots of foods that have lots of fiber in them. Sweet potatoes, a lot of fruits have a lot of fiber in them. Bran cereals, you'll see they say fiber 1 or whatever. You've seen those cereals. So everybody needs a good amount of fiber in their diet, but these can help to increase that. So these are, it says, considered the safest to use, like over, if you're going to use them consistently. Notice that methyl cellulose, you may have heard that word, cellulose. Before we talked about, in the beginning of the year in anatomy, we talked about you have your monosaccharides, your polysaccharides, and then you have your cellulose, that's fiber. It's like a starchy type of substance. And then Metamucil, you've probably seen that before too, commercials for it. Bowel evacuant laxatives. So these increase the osmolarity of bowel fluid, so you have to be really careful with these. They can kind of mess with your electrolytes. Patient should fast for 3 hours before administration, and then 8 ounces should be taken every 10 minutes until you get 4 liters. Now that's kind of depends. This is usually something that you give if someone's going to have a procedure on their bowels. Like if they're going to go in and have a colonoscopy, this would be a medication that they get ahead of time to evacuate their bowels. So it makes them get rid of everything that's in their GI system so they can see, really well. Not a fun moment, I would think. Antiemetics, this next one. Emesis, it just means to vomit. So an antiemetic is an anti-nausea medicine, basically. Antiemetic, anti-nausea. You ever heard of an emesis basin? Okay, you know those little kidney-shaped basins that you see at the hospital? People, they're always got in the rooms. They're kind of shaped like a kidney bean. It's called an emesis basin. That's vomiting. And emesis is vomiting. It says inhibits the impulse going from the chemo trigger zone to the stomach. So usually used to treat side effect, which is nausea. So lots of medicines you've seen that can cause nausea. Phenothiazines may cause hypotension and must be used cautiously in children because of risk for overdosage. Promethazine suppositories need to be refrigerated and protected from light. Promethazine is commonly prescribed. Dimenhydrinate on here, that's Dramamine. That's for motion sickness. You've probably heard people talk about that. Sounds a lot like diphenhydrinate, which is Benadryl. It actually works the same way, still like an antihistamine. These are still antihistamines. Meclizine, Antivert, that's another type of allergy medicine, but it's the same idea. Reglan and Zofran, the ondansetron. Zofran is very commonly prescribed. It comes in a sublingual tablet too that like melts under your tongue. It's pretty expensive though. And then promethazine or Phenergan is kind of your, or at least used to be like a go-to anti-nausea medicine for the hospital. You can give it all, look, comes tablet, syrup, IM, IV, or suppository. Makes people really drowsy. All of these are going to make people pretty drowsy for the most part. You know, people are like, oh, knock me out. So it makes them really sleepy. Anti-flatulence, so it says reduce surface tension, resulting in gas bubbles being released more easily. So people take these for flatulence, that's just gas. Okay? So these are anti-gas medicines. Post-operative gas pains, a lot of times people get that because their belly's just been immobile for a long period of time if they're in surgery. And a lot of the medications given in surgery like dry up. You know, like atropine is one example. It dries up respiratory secretions so that they're not at risk for pneumonia. But it also would do the same thing for the valves too, kind of dry them up, so cause other issues with that. Simethicone, like Gas-X, is one example of that. Obesity drugs. Look, males 25% of total body weight over the ideal body weight is what's considered obese, and then females is 35%. Adverse reactions of these are stimulation, dizziness, fatigue, insomnia, dry mouth, nausea, abdominal discomfort, lots of them. Constipation, hypertension, palpitations, arrhythmias. Lots of them there. All of these are controlled substances, except for the one that's in the CAL, both federal and state controlled substances. We know have to do that. Oh, we talked, there's a couple of Schedule II drugs that were on there on our med list in the beginning that were for weight loss. Make sure I know which ones before I say it out loud.
We're talking about.
Well, maybe not Schedule II. Maybe they're Schedule III. Yeah, Adipex. There was a Schedule IV, actually. That was one example that we've seen. So that was on our med list from week 3. Okay. Several on here. And then it also has this list that's treatment for other diseases, and they're all ulcerative colitis, basically. All those lower ones are. That's what they're for. Okay? And while we're in here, let's just go ahead and go over the urinary system drugs that are in here too. They're already on this page 43. And there's not any of those listed, I don't think, in the PowerPoint, so don't worry about that. We'll just go with the ones in here. Okay, urinary system drugs. Obviously, we know kidneys filter our blood, get rid of any toxins that are in our system, anything that's extra electrolytes, extra sugar, all of that stuff, it shows up in the kidneys. So these specifically, we're going to talk about the diuretics because that also plays a role in blood pressure, okay? Because it's got to filter all that extra out so that we don't get too much fluids in our blood vessels, which puts extra pressure on our hearts. Thiazide diuretics. It says these promote sodium and water excretion in the urine, resulting in lower sodium levels, blood vessels, and a reduction in vasoconstriction. So it says promote sodium and water. Remember, we talked about osmosis and anatomy. Water follows salt. Okay, so if these help get rid of that, it's going to help get rid of water too. That's why when we eat a lot of sodium, it causes us to swell too, because it holds, water is attracted to it. So indications, adjunctive therapy in cardiovascular diseases like hypertension. So a lot of times people take this specifically for hypertension or the edema. We know hypokalemia is an adverse reaction. We've talked about that before, because it also gets rid of potassium. Hypomagnesemia, so same thing with magnesium. Hyperuricemia, uric acid. We have uric acid in our blood, and it should get filtered out because it's a product something that our body produces is uric acid. This can cause us to keep too much of that. Photosensitivity. Patients may be advised to take potassium supplements. So again, I told you guys, whenever you see that a diuretic has been prescribed, if it's not a potassium-sparing diuretic, if it's a thiazide diuretic or a loop diuretic, look, do they also have potassium? That would be something just to question. I'm not saying that every single person who gets these has to have potassium. They may have something else that keeps them, that makes them keep it, but that's kind of something to look for. So HCTZ is listed on here. Hydrochlorothiazide, we've talked about that one before. Loop diuretics. These inhibit the reabsorption of sodium and chloride in the ascending loop of Henle. That's a specific part of the nephron of the kidney. So that's why these work in different places. Again, for hypertension or edema. So same thing, low levels, sodium, chloride, magnesium, calcium, potassium, all those things that it makes our kidney get rid of because it's kind of overworking the kidney, if you will. Diuretics should be taken early in the day. We talked about that before too. You don't want them taking it, in the evening, otherwise they're going to be getting up all night long to go pee. Examples of these, major one there is furosemide or Lasix and torsemide. Those are the two most commonly seen ones, but Lasix, that furosemide, you'll probably see it. So again, they may be prescribed potassium to help prevent that hypokalemia. Okay, potassium-sparing diuretics are going to have the opposite effect. They make us hang on to our potassium. So the normal amount of potassium that we would get rid of, we may not get rid of. Exchange of sodium is excreted in urine. So still getting rid of fluid, but we're hanging on to the potassium, so it can cause hyperkalemia, which in turn would cause arrhythmias. Gynecomastia in males is like oversized breast development in males. Should be avoided in patients taking ACE inhibitors because they also make you hang on to your potassium. Okay. Spironolactone and that diarrhea and that tranturine, those are probably the two most common ones that I have seen on there. So spironolactone you probably will see. And then you have combination products. So again, these a lot of times include your potassium sparing. So hyperkalemia is still an issue with these. And again, with the ACE inhibitors, look at this one. Maxide may experience a change in their urine color to blue-green. That's something that you should tell them. Otherwise, they're going to flip out when they go to the bathroom. Look at this last one. These are more urinary, but we're going to go over them anyway, even though they're not necessarily particularly kidney agents. Alpha blockers used in the treatment of prostatic disease. So prostate is a male organ, and it's actually kind of donut shaped, and it wraps around the urethra. And so when the prostate is enlarged, which happens commonly in older men, then it also constricts the urethra, which obviously causes problems urinating. So lots of older men have BPH, benign prostatic hypertrophy, which is just enlarged prostate. Benign means it's not a cancer. It's not prostatic cancer, but it still causes the enlargement. So these help to relax smooth muscles, especially in the prostatic tissue. That will reduce their issues with the constriction of the urethra. So it can also cause orthostatic hypotension. So when they stand up, blood pressure drops and they get dizzy. So look at these most common ones on here that I've seen. I've seen Cardura and Avodart. I've seen both of those. I mean, I've really seen all of these, but probably the most common ones are the ones I starred. That finasteride or Proscar, like prostate, except for it's prostate, but you see the difference in the word there. And then Flomax is the other one, which makes sense. Maximize the flow. Okay, makes sense of that one. So remember those two for sure. Renal disease agents, that next box, I didn't star anything, but that is something that you probably need to look over. So Aranesp, Epigen, or Procrit, these are all medicines specifically for the kidney if the kidney's not functioning properly. And then these last ones are specifically for, it says prostatic carcinoma, so that's prostate cancer. You would see those. Urinary tract agents, I think we looked at these and we did anti-infectives, but anyways, bactericidal agents used to treat UTIs specifically. Pyridium is commonly prescribed, but look, it's an anesthetic that you take with the antibiotic. And then other than that, Ditropan is antispasmodic used to decrease frequent urination, so people are going all the time. Sometimes that's a result of bladder spasms, which are extremely painful and can cause sometimes bladder spasms. You can get bladder spasms, maybe you just have a spastic bladder, but you can get them sometimes when you have a UTI, and very, very, very painful. But they'll cause increased frequency of urination because it's like they constantly feel the need to go because the bladder is spazzing. So that's what those are for. Okay? That is that.